Your heart isn't just one single pump. It's this incredible, high-performance four-chambered engine. But today, we're zeroing in on the main event, the one chamber that's the absolute powerhouse, the one responsible for keeping your entire body up and running.
So, let me just ask you straight up, which of those four chambers do you think is the most powerful one? I mean, which one has the biggest job, keeping you going every single second of every day? Go on, take a guess.
If you guessed the left ventricle, you are absolutely right. It is, without a doubt, the heavyweight champion of the heart. So now let's really get into why it's earned that title.
All right, first things first, let's talk about its job. And this isn't just one little task among many. This is the critical mission, the one your whole body is counting on.
I mean, just think about the sheer scale of this operation. It's not just pushing blood next door to the lungs. No, the left ventricle has to power the entire systemic circulation. That means sending fresh, oxygen-rich blood from your brain all the way down to the tips of your toes. The pressure it has to generate is just immense. In fact, this muscle is so significant that it physically forms the very tip, or what we call the apex of the heart itself.
So, that leads to a pretty obvious question, right? How in the world is it built to handle that kind of workload for an entire lifetime? Because a job this big requires a very, very specific design.
So next up, let's take a look under the hood at the anatomy of this powerhouse. It's just a perfect example of form-following function, where every single detail is engineered for maximum force.
Take a look at this number, 8 to 15 millimeters. Now, that might not sound like a whole lot, but in the world of cardiac anatomy, wow, that is monumental. This right here, this is the secret to its strength. Yep, that 8 to 15 millimeters of thickness makes the left ventricle's walls the most muscular of all four chambers, and it's not even close. It's just pure, raw power, built to contract with incredible force.
Now let's compare it to its neighbor, the right ventricle. See, the right ventricle only has to pump blood to the lungs, which are right next door. So it's wider, kind of crescent-shaped, built for a low-pressure job. But the left ventricle? It's shaped more like a rocket engine, conical and long, perfectly designed for generating that high-pressure blast of blood out to the whole body. Even the inside surface is different. The muscle ridges are finer, creating a smoother, more efficient path for ejection.
So here's the basic blueprint. Blood comes in through the mitral valve, which is like a one-way door from the left atrium. Then it gets blasted out through the aortic valve, which is the high-pressure exit to the rest of the body. And inside, you've got these tiny but super important papillary muscles. They act like little puppet strings, pulling on the mitral valve to make sure it snaps shut and doesn't leak a single drop during that powerful squeeze.
Okay, so we've seen the design, we've got the blueprint. Now, let's watch this thing in action. This is the pumping cycle, the powerhouse doing its job with every single beat of your heart.
It's this really beautiful, simple four-step process. First, the chamber relaxes and fills with that oxygen-rich blood from the left atrium. Then, boom! Those thick muscular walls contract with that immense force we talked about. This pressure slams the inlet valve shut, forces the outlet valve open, and ejects the blood into the aorta. And from there, that one pump supplies the entire body. Fill, contract, eject, supply, over and over and over again.
And that whole process, that's what we call systemic circulation. The big takeaway here is that the left ventricle is the starting line for this massive, body-wide loop that delivers oxygen to every single tissue you have. And that's exactly why if this one pump starts to have problems, the entire system is in trouble.
And it goes without saying, right? A muscle that works this hard needs its own dedicated fuel line. And it gets it from the left coronary artery and its branches. They feed the muscle of the ventricle itself. The powerhouse needs its own power.
Okay, and finally, this is where it all comes together. We need to talk about why all this anatomy and function really, really matters. Because when this pump fails, the clinical stakes are incredibly high.
Remember those thick, powerful walls we just talked about? Well, sometimes they can become too thick. The condition is called left ventricular hypertrophy, or LVH, and it's often a response to something like chronic high blood pressure, which forces the ventricle to work even harder to get the blood out. So the muscle bolts up, but it also gets stiffer and, well, less efficient.
And that can lead to some really serious problems. In left heart failure, the pump just gets weaker, and it can't push blood forward like it should. This creates a sort of traffic jam, causing blood to back up into the lungs. That's why a key symptom is breathlessness.
And of course, a heart attack, a myocardial infarction, often involves a blockage in one of those coronary arteries, which starves the ventricle's wall of oxygen and can permanently damage the pump itself.
So you see, it all connects. Understanding the basic design, those thick walls, that high-pressure job, is absolutely key to understanding some of the biggest and most critical issues in all of medicine. The anatomy and the clinical problems, they're really just two sides of the very same coin.
When you really step back and look at it, the left ventricle is just a true masterpiece of biological engineering. It's a muscle that is perfectly, and I mean perfectly, designed for one relentless high-pressure job, keeping us alive with every single powerful beat.
And that really brings us to the final thought here. This incredible powerhouse sitting in your chest beats over 100,000 times a day, every single day. So knowing what you know now about its vital role and its vulnerabilities, the question isn't just academic anymore, it's personal. How are you going to protect yours?